Over 81,000 people lost their lives from opioids in 2023. This epidemic demands immediate action. Hello, my name is Russ Evans from AVAN Mobility. The opioid crisis isn't just a statistic. It's a daily reality, claiming over 81,000 lives in 2023 alone. Behind every single number is a community that is overwhelmed, a family that is devastated, and a person that didn't get the help that they need. Fixed harm reduction sites can only do so much, leaving entire populations without access to care. Those that are in remote communities, unhoused individuals, or those that are just too ashamed to seek care are falling through the cracks. That's where these mobile overdose prevention vehicles come into play. These vehicles not only bring healthcare into your community, but also hope and trust to those that are feeling the harshest effects. In this video, we'll go over the key differences between mobile overdose prevention and harm reduction sites. This will give you the clarity to choose the best solution to deliver the highest impact in your community. First off, what is mobile overdose prevention? Mobile overdose prevention provides flexibility and rapid response for addressing substance use. We've seen a lot of very positive outcomes with mobile overdose prevention. Things like overcoming the transportation challenge by being able to go right directly to where the people are, overcoming stigma by being able to again go and meet people where they are versus people having to get time off or answer questions about why they went to a specific clinic. It also helps a huge amount with those experiencing unhoused situations because they don't have a front door to lock. They're concerned about leaving their belongings, going somewhere, and then coming back and their belongings no longer being there. One of the most incredible experiences that I had was visiting a very remote community who was really struggling with substance abuse and overdose challenges. The organization that was responding to those challenges, they went mobile, and they have a track record of bringing people who were experiencing unhoused situations, often seeking out illicit drugs, and they built the trust, they got them onto a program, and those people became housed, they reconnected and reunited with their families, as well as even got jobs in a very short period of time. Now let's look at harm reduction sites. They provide stationary, localized services, but are often limited in their reach. Services that can be found in a harm reduction site are very similar to those that are found on a mobile unit. Things like access to services, counseling services, testing of the substances itself, as well as having the ability to meet with a number of individuals and potentially even visiting with peer support, seeing others using the services are often big advantages to a fixed location. Some of the barriers that we see with harm reduction sites is those who can't travel and don't have access to transportation often can't make the arrangements to come to an actual fixed site. Often the population that we're trying to treat that need the services are transient and they move around, whereas the fixed site has its limitations from being able to move around. The other challenge with fixed sites is it often brings a certain stigma to the neighborhood that is met with unfriendly and challenged by opposing neighbors. Now let's look at the advantages of mobile overdose prevention versus harm reduction sites. Mobile overdose prevention offers advantages that fixed harm reduction sites just can't offer. The mobility of mobile overdose prevention is really the key thing to going into these remote areas where the challenges are actually being experienced, understanding what the needs are, and then deliver the services that directly correlate with the challenging that area is facing. Mobile overdose prevention is much more cost-effective when it comes to starting and building a harm reduction site. And we all know how long it takes to get approvals and permits and things like that. So providing mobile can be done faster and is just a vehicle at the end of the day that you can purchase versus a bricks and mortar building that has to be purpose-built or renovated to provide the actual solution that's needed. We know that trust is built over time. Day one is I've got to know your name. Day two is I've got to know a little bit more about your situation. Day three is maybe I can provide some help or even just give them something that they need like water or something simple. Over time, that trust builds up again and again and again, but they're expecting you to come back to them. We've seen very challenging situations overcome by breaking down the barriers and the whole psychology that goes into I have to go somewhere versus somebody's coming to me. Hopefully you now have clarity around mobile overdose prevention and harm reduction sites. Every day, the opioid crisis is claiming more lives that could have been prevented if we had just reached them in time and given them the help that they need. Just think about the lives that could have been saved in your community if we could have been able to reach those that need it. If you're looking for more information on our Mobile Overdose Prevention Unit, we've provided a link below. And as always, if you've got any questions, please reach out. We're always here to help.